Hi, my name is Amanda LaRue. I have Ashley Rendulic here, and we're going to go through the a health assessment. Hi, how are you doing today, Ashley? Good. I am going to ask you a couple serious questions, but my name is Amanda LaRue. I am a registered nurse. So tell me about your all health and what medical conditions have you been diagnosed with in the past, and what health concerns are you currently managing? So in the past, I actually suffered from infertility. I went through IVF to have my daughter, and currently I am struggling with my weight, trying to get that down, and I'm also having physical therapy on my left hip currently. So tell me a little bit about your family history. Is there any medical conditions such as heart disease, diabetes, high blood pressure, cancer, or other illnesses that run in your family? So unfortunately, a lot of stuff runs in my family. My dad is currently have thyroid cancer that is in remission, and he is diabetic and have high blood pressure. We have two aunts that passed away from non-Hodgkin's lymphoma, and then also high blood pressure with my grandmother and my mother. For medications, tell me about your medications, vitamins, or supplements, or over the counter medications that you take. How do you take them every day? So, the only medication I currently take is a multivitamin at night, but unfortunately, I forget about it all the time, but no other medications. Yeah, we do that. It's okay. Just try to take it. For your surgical history, describe any surgeries, hospitalizations, or any major medical procedures that you've had, and how are they affecting your life? The only surgeries that I've had is my wisdom teeth out, and I had IVF, which includes an egg retrieval and an implantation surgeries. And then also I gave birth, so that's the only hospitalization that I had. I did have high blood pressure with my pregnancy at the end. For your nutrition, walk me through your typical eat and drink, what you eat and drink in a normal day, and how do you feel your eating habits affect your overall health? So with morning time, I have coffee, and of course, I have like English muffin and sausage, and then lunchtime, it kind of depends on what was dinner the night before, because a lot of times I bring over leftovers. Most of my leftovers include like salmon, steak, chicken, tacos, a lot. um, Now I could reduce my snacking habits, stay away from the sweetness. Tell me about your physical activity or exercise routines. What do you do? What do you enjoy doing? So I do go to the YMCA, and I do Zumba on Sundays and sometimes Mondays, but currently not doing Mondays because of physical therapy. I try to increase my walking just because I can't get to the gym on that day. So a lot of times I'll walk around the neighborhood twice. Describe your typical sleep routine. How well do you sleep, and how rested do you feel? I do feel pretty rested. I mean, I do go to bed at 10 o'clock and then get up at around 6. But at times I do wake up in the middle of the night, like 2, 3 o'clock, and then takes me like an hour to go back to sleep. So those days I don't feel that rested. Sometimes it's just so stressful of the next day or know what I need to do. All right. Tell me about your any recent changes that you've noticed in your health, weight, energy, recent illnesses. The major thing is that I'm getting physical therapy on my hip, and I had increase of weight just because of diet and not being able to get to the gym as often. Any changes that you've noticed in your skin, such as moles?
Skin has been good. I do get it checked yearly for derm.
Good. Tell me about any changes in vision, such as blurriness, double vision.
No changes in vision. 2020.
Describe any chest discomfort, pressure, or pain.
The only time I had an AFib occurrence, but my blood work was good, and they were able to figure out that it was probably just stress.
Any stomach or digestion concerns you're experiencing, including nausea, vomiting, abdominal pain.
Bowel movements have been regular, and nausea and everything has been non-existent. I've had an ulcer before, but we decreased our fatty food and spicy food intake.
Any joint or stiffness, joint pain or stiffness or swelling that is affecting you.
The major thing is my left hip. They are saying that it's trochanter bursitis, and I'm getting physical therapy twice a week to try to strengthen that muscle group.
Any episodes of dizziness, fainting, or problems with balancing.
No balance or dizzy issues.
Describe how you feel emotionally. How has your mood been?
My mood has been great. I have my family to support me on my everyday, and when I do get stressed, they are just a phone call away.
Tell me about the people in your life that support you. How does your family, friends, or community help you manage your health?
My family are the major people. My husband, my twin sister, my parents have always been there. They can talk me to anything, and it's nice having a friend group at Zumba to help encourage me to exercise.
Any use of alcohol, tobacco, or illicit drugs?
No tobacco use or any illegal drugs or any of that kind of stuff. I do drink social.
Tell me about your financial situation that can affect your health. Any challenging paying for medication, healthy foods, transportation?
Financial issues have all been stable.
Tell me about your cultural beliefs, traditions, or home remedies that influence the care of your health. Do you use any alternative therapies?
No alternative therapies, and my family's my support group.
Environmental. Tell me about your home environment. What features to help keep your family safe do you have, such as smoke detectors, carbon dioxide detectors, or anything else that affects your well being?
I have smoke detectors, and I have carbon dioxide, and I have a security system to help keep us safe.
Tell me what you do for work, and how does your job or education affect your physical and emotional health?
So I'm an X-ray tech. I also do mammo, which is new to me, and
Anything affecting your physical?
so my job can be very physical and can aggravate different muscles and stuff during my daily use.
How would you describe? Do you feel Do you feel safe at home, at work, and in your relationship? Is there any concerns that affect the sense of well-being or safety?
No concerns with safety or anything with my home life or work life.
Perfect. Well, thank you for taking the time with me today. I appreciate it.
Oh, you're very welcome.